Special K, a new hope for treatment-resistant depression. A hallucinogenic drug known on the street as Special K offers new hope to those suffering from severe, treatment-resistant depression. Depression is the most prevalent psychiatric disorder and ranked among the top causes of disability and disease burden in the world. Common treatments for depression are effective for most patients. But 30% do not respond to any of the antidepressant treatment at all. For these patients with treatment-resistant depression, novel therapeutics are a necessity. With the advent of newer technologies and findings, psychiatry is vehemently trying to discover new treatments and better understand their therapeutic actions. Ketamine alleviate the depressive symptoms associated with major depressive disorder. Ketamine was originally developed in the 1960s as the anesthetic and recreational drug. Since then, studies investigating ketamine's mechanism of action and potential clinical application are going on. In a recent study published in the Proceedings of the National Academy of Sciences, on June 8, 2015, optogenetic stimulation of infralimbic PFC reproduces ketamine's rapid and sustained antidepressant actions. Ronald S. Duman, Professor of Psychiatry and Neurobiology, Department of Psychiatry, Yale University School of Medicine, New Haven, investigated the potential role of the prefrontal cortex to mediate the antidepressant and anxiolytic effects of ketamine. This is by directly manipulating the activity of the infralimbic and prelimbic areas of prefrontal cortex that are involved in cognitive and emotional processes. Whether silencing neuronal activity in either one of the areas prevented the behavioral effects of ketamine. In the studies, ketamine seems to rapidly induce plasticity at glutamatergic excitatory synapses, quickly alleviating anxiety and depressive symptoms. Ketamine reversed the reduced activity in the prefrontal cortex of treatment-resistant depressed patients. Future investigations will need to more precisely determine which types of pyramidal neurons of the prefrontal cortex are contributing to the therapeutic effects. Efforts are underway to develop analogs of ketamine that produce longer antidepressant effects with fewer side effects.